Let's see an NCLEX RN video based on care for patients with infectious respiratory disorders. Infectious respiratory disorders include coronavirus, influenza, which includes H1N1, pneumonia, and TB. So let's see the questions. The nurse recognizes that the first physical compensatory mechanism of decreased oxygen delivery is which of the following? Is it increased heart rate, increased respiratory rate, decreased heart rate, decreased respiratory rate? So the first compensatory mechanism when oxygen delivery is decreased is increase in the respiratory rate. The nurse recognizes that the second physical compensatory mechanism of decreased oxygen delivery is which of the following? What is the second compensatory mechanism a person does when there is decreased oxygen delivery? Is it increased heart rate, increased respiratory rate, decreased heart rate, decreased respiratory rate? So when oxygen supply is decreased, first there will be increased respiratory rate and the second mechanism is increase in heart rate. During the assessment of a patient admitted with pneumonia, the nurse notes that the patient is experiencing agitation and restlessness not evident on prior assessments. What should the nurse's initial response be to this assessment finding? Obtain an oxygen saturation measurement with pulse oximetry, notify the physician, auscultate breath sounds, comfort and calm the patient. So the patient has been admitted with complaints of pneumonia and the patient is having an experience of agitation and restlessness. It was not present in the prior assessment, now it is shown by the patient. So at that time, the initial response by the nurse is first to obtain an oxygen saturation measurement with pulse oximetry. Then the nurse can auscultate the breath sounds and notify the physician. Whenever anything is being done, it is to comfort and calm the patient. Here the priority is to take the oxygen saturation. A patient with MRSA pneumonia can be cohorted or share a room with which of the following patients? A patient with an MRSA infected foot ulcer, a patient with a confirmed influenza infection, a post-operative patient with open reduction or internal fixation of the right hip, a COPD patient with chronic obstructive pulmonary disease who is receiving steroids. So here the patient has got MRSA pneumonia. So this patient cannot be in a room with post-operative patient or a COPD patient with steroids because there is a risk for the other patients to get this infection. And this MRSA foot ulcer, that patient cannot be grouped together with a patient with MRSA pneumonia because foot ulcer patient does not need droplet precaution. So here from these four patients, this MRSA pneumonia patient can be cohorted with a patient with confirmed influenza infection. Acceptable room assignments for a patient with suspected or confirmed TB should be which of the following? Cohorted only with other TB patients, cohorted only with patients who are not infected with TB, isolated in a private room, isolated in a private room until confirmed and then cohorted once treatment has begun. TB patients should be isolated in private room and that too with negative pressure room. So here the option is the TB patient should be isolated in a private room. They should not be together with any other patient. The nurse understands adequate teaching has been done by which of the following statements? I got a flu shot last year. I am covered for a while. I don't need a flu shot. I never get sick. I guess it's important to get a flu shot every year. I don't get a flu shot but I make sure my kids get it. Here flu shot should be taken by the adults and children every year? So the answer is, I guess it's important to get a flu shot every year. The correct statement about the prevalence of pneumonia is which of the following? Pneumonia is no longer a major health problem. The prevalence of pneumonia is increasing dramatically. The prevalence and mortality are highest in persons older than 65 years. The frequency has not declined, but mortality has declined. So the correct statement regarding the prevalence of pneumonia is, the prevalence and mortality are highest in persons older than 65 years. The nurse understands the priority intervention with the patient with TB in which of the following? Antibiotic administration, initiation of isolation, TB test, chest X-ray. Of course, when a patient is coming to the nurse with TB, the first point is to isolate the patient, that too in private room with negative pressure. So isolation is the priority. Of course, multi-drugs we need to administer to the patient, TB test need to be done, and chest X-ray to be taken. So this is a case in which Mr. Mark, 70-year-old man, presents to the emergency department with fatigue, weight loss and night sweats. He complains of a cough that produces rusty colored or blood-streaked sputum. Vital signs are BP 145/85 mmHg, heart rate 95 beats per minute, respiratory rate 22, pulse oximetry shows 92%, temperature is 100.3 degree Fahrenheit. Mr. Mark works as a volunteer in an HIV community support center. Past history consists of coronary heart disease with 2 cardiac stents which is placed last year, mild emphysema, long-term type 2 diabetes and arthritis. His current medications are aspirin, ipratropium, 2 puffs 3 times daily, celecoxib, metformin and over-the-counter daily multivitamin. Chest X-ray shows suspicious cavitating lesions. So cavitating lesions result from the pathogenic processes leading to the necrosis and formation of a gas-filled space within the lung tissue, and it is seen on the chest X-ray of TB patients. So with all the symptoms, the patient is admitted with suspicion of TB. He is put in isolation on airborne precautions. The temperature, heart rate, respiratory rate remain elevated. Oxygen saturation decreases to 90%. He is started on oxygen via a face mask. An IV line is inserted and IV fluids are started. Sputum and blood cultures are sent to the laboratory. Mr. Mark, after all these things, he is diagnosed with TB. He remains in a private negative airflow room on strict isolation and airborne precaution. He started on 4-drug combination therapy for the treatment of TB for 9 to 12 months. So you know that for the TB patient, the 4 drugs are isoniazid, rifampicin, pyrazinamide and ethambutol. It is suspected that he was exposed to TB at the HIV clinic where he volunteers. So you know that HIV patients are more prone to get this TB infection. So personnel are alerted and sent to screen the patients and staff at that HIV clinic. Hope you understood the scenario. Which statement is correct related to isolation and airborne precaution for Mr. Mark? Mr. Mark should wear a mask at all times. Staff entering the room should wear a surgical mask. Visitors entering the room should wear an N95 mask respirator. Staff entering the room should wear an N95 mask respirator. So here the patient is already in a private room with negative pressure. So there is no need for the patient to wear a mask at all times. But if Mark is going out of the room, for any reason, at that time Mark should wear a surgical mask. Second one, the staff entering the room, they should not be wearing a surgical mask. They should wear a N95 mask respirator because they are going to stay with the patient for a long time. They are going to care for the patient and they will be in contact with the sputum. So airborne chances are there for the staff who is entering. So N95 mask respirator is needed. The visitors also don't require N95 mask respirator, but they require a surgical mask which is well fitted because they are not going to stay for long time. So here the answer is the staff entering the room should wear an N95 mask respirator. The nurse should question which order concerning Mr. Mark's care. Humidified oxygen via nasal cannula, NPO, vital signs with oxygen saturation every 4 hours, activity as tolerated. So here of course the patient needs humidified oxygen with nasal cannula because the oxygen saturation was going down. The vital signs need to be checked 4 hourly and activity as tolerated the patient must be doing. But the patient should not be restricted in the diet. NPO should not be a good order for this patient. Mr. Mark's TB can be characterized as which type of infection? Is it an LTBI, latent tuberculosis infection, or PTBI, that is the primary tuberculosis infection, or a symptomatic non-contagious TB infection, or a symptomatic TB infection? So here you know that the Mark had a symptomatic TB infection because it is evidenced by his productive cough, fever, fatigue. So that shows the patient had symptomatic TB infection. Here I would like to add some more points regarding the classification of tuberculosis. Mainly, tuberculosis can be classified into 4. First is latent tuberculosis infection. So in those individuals with an intact immune system, a granuloma forms and it will limit the further proliferation and spread of the mycobacterium. The necrosis at the center of this granuloma leads to fibrosis and calcification, and a calcified granuloma, it is evident on the chest X-ray, is a classic sign of latent tuberculosis infection. So here the bacilli is inactive, that remains dormant within the healed granuloma. So the patient with LTBI has no symptoms, they do not feel ill and they are not contagious. So as long as the immune system remains intact, the bacilli remain in the healed tissue of the granuloma and it will not proceed to TB infection. But once the patient's immune system is lowered, especially with HIV infection or long-term diabetes, chronic renal disease or long-term steroid administration, sepsis or malnutrition, there are chances this bacilli become active and shows the signs of TB. So that is the first one, that is latent tuberculosis infection. The second one is primary tuberculosis infection. So it is often asymptomatic and is confirmed only by a positive sputum culture and positive skin test. And here also the patient is not infectious. Individuals with a weakened immune system, they are unable to control the multiplication of this mycobacteria. So this granuloma formation is initiated but is unable to progress to calcification. So that happens in primary tuberculosis infection. So they are not infectious but they can show this positive sputum culture and positive skin test. Then third classification is symptomatic TB, or which is also known as primary progressive TB infection. They shows the symptoms like fatigue, weight loss, night sweats, like what our patient Mark has showed. Then cough will be developing eventually and it will progress to a rusty colored or bloody streaked sputum you can observe. Then later on the disease progress to dyspnea, orthopnea, rales. Then the fourth type of classification is drug-resistant mycobacterium tuberculosis. And it can be a monodrug resistant or polydrug resistant can happen. So hope you understood this. Which statement demonstrates adequate teaching has been done? Wow, I'm going to be on these drugs for a long time. I can stop taking the drugs when I feel better. My family doesn't need to wear a mask when they come to visit. I'm looking forward to going down to the cafeteria to get something to eat. Of course, the patient has to take the drugs for 9 to 12 months, so they have to take for a long time is the correct answer. They should not stop once they are feeling better. That will result in drug-resistant Mycobacterium tuberculosis. And family members need to wear a surgical mask when they are visiting the patient. And when the patient is going out also, the patient needs to wear a surgical mask. What symptom is an indicator of a resolving TB infection? Select all that apply. Decreased sputum production, productive cough, stable body weight, fever only at night, cessation of night sweats. So the TB infection is resolving. So that is seen by decreased sputum production, then stable body weight, and the cessation of night sweats. The other two, productive cough and fever at night, shows that there is TB infection and it shows the symptoms of TB. Hope you understood this video. Thank you so much.